So let's have a look on a patient. So we've got a single rooted, obviously, incisor there, complicated fracture. I can't work between these two teeth or these two teeth because both this and this first and third incisor are perfectly healthy. I only want to remove that second. So my safe places are labial and on the opposite side lingual. So I have my finger very close to the blade tip. My other hand supports the area, and actually my fingers would be pinching around that tooth. I've pulled my fingers apart, otherwise you can't see where the blade is, but my fingers would be pinching that tooth and steadying everything, controlling everything. My forefinger being so close to the blade tip means that if I were to slip, that forefinger would bump into that forefinger. We've got a finger stop, in other words, and therefore I'm less likely to damage both my own hand and my patient. I'm going to work on the lingual, I'm going to work on the labial, and I will alternate until we've got it nice and loose. At that point I can use the forceps, which basically are a pair of elevators that are crossed over with a hinge in the middle. If you see them that way, what you want to do is drive the beaks as far down that tooth as possible onto the root, so as far down the root as you can, get a really stable grip, and then your first function or first action is to push that tooth inwards, so kind of counterintuitive, but apical pressure. And you do that for, again, your 10-20 seconds, and then you can apply a secondary motion wherein for an incisor, which is sort of triangular in cross section actually, that would be a lingual to labial lean on the tooth, if you will, but gently does it. Everything has to be really gradual, because you're trying to ease it. Remember, what are you trying to do? Break down periodontal ligament fibers. They don't need loads of force, you just need a bit of sustained pressure, and expand that socket very slightly. It's bone, so we need to sort of harness its elasticity, but gradually get it to ease out of the way for us, not try and force it quickly, when of course, bone being bone, it will just break, and if it doesn't break, the root will.